Hello, in this talk I'm going to talk about the universal mental health interventions and how they're guided by perceptual control theory. I've called it living in the loop, which is a phrase I got from a colleague of mine, Tom Schultz, who's a professor of theatre studies in UBC in Vancouver. And I think it really brings to life what it means to understand the world and ourselves according to perceptual control theory. It is a life in the loop. And the image for this slide is going to be the cover of a new handbook that we're working on together that I'll share with you shortly. So there are many global issues affecting us in the world, and so many of them relate to our behaviour. They're either affected by what people do or people have an influence on them. Whether that be in mental health, health decisions, even global conflicts. So we need to understand human behaviour better. We need to use that understanding to facilitate positive change for people, and we need to provide interventions that are scalable because of the global nature of some of these challenges. So I guess the question that I find very important to answer is, what is behaviour? How do we define behaviour in the first place? And so if you look it up, the way that behaviour is defined is fairly circular and fairly kind of focused on a particular approach. The way in which an animal or person behaves in response to a particular situation or stimulus. Now, that is the current definition that many people subscribe to. Is it really an accurate way of understanding behaviour? Is a behaviour a kind of packaged response to something stimulating that happens in our environment, or is it something different? Think of a simple behaviour like opening a car door. What is this behaviour? Is it pulling the handle? Well, it feels like pulling the handle, but doesn't the force that you pull the handle depend on things to do with the environment, the weight of the door, the stiffness of it? So in that case, is the behaviour pulling the door into an open state? Is it the state of the door? But clearly that doesn't happen on its own. There's something about what we're doing in an interaction with something in our environment that defines the behaviour. So what is that kind of interaction, and how does it look? Here is a video that you might also see on my YouTube channel that was a video of a demonstration developed by Bill Powers, who developed perceptual control theory. And just looking at it helps you to understand what a behaviour is and whether a behaviour is well defined by the observer noticing that behaviour, or whether it's defined by the individual who's carrying it out. So in this video, the person on the left is moving the pen on the page, and the person on the left is given an instruction. Sorry, the person on the right is moving the pen on the page, and the person on the left has been given an instruction for what to do. Their movements will also leave a trail on the page, so you can see exactly what the behaviour is, you would think. So what you need to do, or what I'd like you to do, is watch this video and try and work out what that person on the left was told to do. Okay, so it's a very short video, and you should be able to see it starting now. So as I say, watch this video and think, what is that person with the green pen on the left doing? They were told to do something. What was it? When most people look at this video, they suggest that it's to draw something, like a kangaroo, or it's to do the opposite of the person on the right, or it's to do the mirror image or copy what the person is doing on the right. Actually, none of these common observations of the behaviour is the accurate one. As you see, these are the studies that we've done, 4 studies independently replicating this now, that most people, when they look at this video, get the wrong answer. What the person was actually doing is keeping the knot of the rubber band over the dot on the piece of paper. So if you look at this video again, you can see that the knot stays very clear near to the dot. And so when it moves away, the person on the left adjusts for that automatically keeping the knot over the dot. And those behaviours that you see, the drawing, doing the opposite, the copying, actually emerge from the person doing the behaviour that they know they're doing, which is keeping the knot over the dot. And this actually has big implications for how we understand behaviour in the first place. Behaviour appears to be something that we do in the moment to control, to engage in control. And in essence, it's the idea that behaviour is the control of perception. In this example, the perception is keeping the knot over the dot, and we've shown that it's from the perspective of the person doing the behaviour that the knot looks over the dot. And they are all kinds of other processes happen that people observe, drawing something, doing the opposite, that actually emerge during this process of the person trying to control a certain aspect of their perception, in this case keeping a knot over the dot. Have a think of an example of what might be another knot and a dot that a person might have. Like, for example, to never feel anxious. If you went through always trying to not feel anxious, depending on your environment, you might do different things to keep that knot over the dot. You might avoid eye contact, move away from someone, change the subject, use alcohol, etc., etc. So the things that we do in the moment can be quite varied because they're our attempt to try and control what matters to us. Now, perceptual control theory, the first paper came out in 1960. It's been around a long time. Let's explain it in a bit more detail. This is a video put together by Ethan Webb and Rick Markham that shows a simple behaviour, drinking a cup of tea, and shows how one might explain it using perceptual control theory. The lady in this example perceives an aspect of her environment, the distance of the cup from her mouth. She compares that to her goal, her reference signal, which is to be as close as possible next to the mouth. And then she engages in an action, bringing it closer to bring that cup up to where she needs it to be. And this is a continuous process because there's disturbances such as gravity, such as her other muscles, which are acting against keeping that tea where it needs to be. And this is a continuous cyclical process. It's not that the input triggers an output. What's happening is there's a constant readjustment of input as the person is reducing that error to make it as small as possible. But actually, this is a simplification. In this example, even of just drinking a cup of tea, the person is also having to keep that cup, the top of the cup horizontal, as you can see, so that the tea doesn't spill out. And there's also an element of this once the teacup is there at the lips to tilt it and to feel that liquid on the mouth. And it's these kind of complex behaviours, most of them, that require understanding another element of the PCT, which is the fact that these control units are organised in a hierarchy. Here's a diagram of the hierarchy drawn by Eva de Hulu, and it illustrates how each one of these units is connected with others, and the goal that each unit has is set by a level above, and the unit achieves its goal by sending signals out to the level below, which in turn sends signals below that. And so this is a whole system where it's perception, it's inputs that are being controlled. Rather than sending out commands to muscles, what each level is sending out is a desired input for what it wants from the level down, which is also sending out requirements to the next level down for what it wants. And it's only at that bottom level that interfaces with the real world that the cycle is closed, although there is imagination that can loop it in between, which we'll come to later. A simple way of thinking about the levels, and Bill Powell specified 11 specific levels of perceptual abstraction, right from intensities of input, which are fairly simple to construct and to perceive, right up to more complex abstractions. For example, one's a system concept at the top, which is a perception of a collection or a constellation of values and principles, like a person's identity. In simple terms, it's why questions that allow you to consider what's going up levels, and how questions which allow you to consider what's going down levels. Okay, there are some other concepts we need to bring in to help show how PCT colours our understanding. People who are, because we are all controlling lots of different variables in our lives, there can be some conflicts that happen, and we can have conflicting goals around what we want. And this happens in everyday experience. Simple things like what flavour of ice cream to choose or what type of car to buy. And there's actually studies of this looking at the kind of high-level goals that affect people's choice of vehicle, to do with status and speed and comfort and family access, for example. So we all have these high-level goals, these answers to the why questions, which influence and pull and push on the kind of decisions that we're making at a lower level. But most of the time we come to a decision, we resolve that conflict. But it's proposed that when conflict between highly valued goals persists, then this is where we can get into trouble and experience distress. So someone who has a goal to stay safe and not hurt by kind of creatures like spiders that might bite them, but on the other hand, they want to be able to go camping, go to their garage, go to situations where they might encounter these creatures. And so they're in conflict about whether they want to face their phobia or not. And a lot of people live their lives without having to do this. It's only when people start to work through this in some kind of exposure exercise that they have to negotiate these conflicting goals. And arguably, the person needs a high level perspective in order to regulate these conflicting goals that they have. What are they, from what perspective are they going to decide whether to face their fear or whether to stay safe? And often when I've worked with people with these kind of difficulties, they do start to get to see their problems in a different frame of reference. So as one example, they might start to get the idea of what it means to be brave. And to be brave isn't to not be afraid. To be brave is to feel afraid, but to do it anyway, because you know that it's important and the right thing to do. And so when people are able to explore and talk about these conflicts that they have in facing their fears, a new perception starts to emerge at a much higher level, a much more abstract, principle-based level of how they can face their fears. And potentially there are other kinds of conflicts that map out differently in different kinds of presenting problems. So for example, how vivid a past traumatic memory is for someone. One may want to block that out of one's mind because it's so distressing. You feel like you're going mad when you remember it. But actually there might be a time in one's life when those memories need to be recalled. For example, giving a witness testimony or having to go into a job where those experiences and those memories are needed. People who have very difficult childhood experiences and then have their own children and want to draw on their memories. These are the kind of conflicts that we see clinically really disturb people. And I've also done work working with people who end up with a diagnosis of bipolar disorder, and they very often have extreme conflict around excited high states of mind, which on the one hand rescue them from depression and give them success, but on the other hand can end them up in situations where they've got into trouble and potentially even got into hospital or done something very, very risky. And so conflict is a key thing to understand, and it's a key focus of perceptual control theory. So how do these new perceptions form that help regulate and balance the conflicting goals below. This is through a process of reorganization. It's the learning process in PCT. And it's quite a simple algorithm. When there's mistakes, when errors are made, changes are made. It's about making a mistake and trying something different. It leads to random changes that happen, not just in the behavior itself, but in these systems that are trying to control for it in terms of their strengths, or we call them gains relative to one another, or maybe how they're balanced over time, for example. But reorganization needs to be focused. We can't just change everything just because one aspect of our life doesn't work. And Bill Powers is often quoted as saying, you don't need to change your religion just to learn how to tie your shoelaces. Reorganization and change start with the very practical, immediate experience of things not working and having a problem. And that's as it should be, because we shouldn't need to change our high level systems if we can fix it at a low level. But what we're proposing in terms of long-lasting clinical problems is that the person very often does need to go to those higher levels to reorganize, because they've tried the lower levels, different ways of doing things, and that's not worked for them. And so therapy is about helping people to shift and sustain this reorganization process to where it's going to make a difference. And reorganization is fascinating, because just like the rest of PCT, it's something that can be modeled and demonstrated to see how it works. And Bill Powers has a simulation that he did where reorganization was applied to arm movement. And he programmed a video of an arm that had 14 different joints, and those different units governing those different joints needed to be reorganized in order to resolve their conflict between one another. They needed to get their gains and their delays just right, so that when a signal was sent from a high level system to produce a certain movement, that was reproduced effectively by the person in their arm movement. And Bill Powers has done a full computer simulation that you can work with in his 2008 book, and there's a video available that shows this. It's interesting. I don't think it's a coincidence that this simulation actually looks like the kind of flaying movements in early infancy that gradually develop into more organized, structured movements as a child gets older. And so I'll be putting these links into the text section of this talk, so you can access them separately. So just as to pause for a moment, let's have a think about what the implications are of PCT for our research methods. It suggests to us that behaviour isn't a discrete chunk, it's continuous and ongoing, and that's going to affect how we analyse it. That variation in behaviour, these moment-to-moment shifts and changes, might be all part and parcel of controlling something. They're not error. They're not simply error, they're actually aspects of this control process that we need to either understand or model. That when a researcher, and this often is the case, presents what we call stimuli to trigger a response or to trigger some kind of information processing stage, this so-called stimulus is actually very often a disturbance to something that individual is trying to control. And if that disturbance happens quickly, then you'll see a slight delay before they try and re-establish control with what looks like a discrete response. But if that disturbance happens in a more gradual way, like in for example, a virtual reality scenario where the participant can control what they are looking at, then this idea of stimulus response no longer holds true, and what you see is this continuous dynamic between action and perception. And I think that is the kind of model of experimental research that we need to go into, going beyond the version that was there since the last century, because we had things like tachistoscopes that we couldn't recreate virtual environments. What else does it tell us? It tells us that controlled perceptual variables are inside people's heads, and our heads are all separate from one another. So we have this ideographic set of goals that each one of us goes around with. And so studying the individual is vital. And if we average data and just correlate across participants, that tells us something, but it's of limited value if we want to understand how a system works, how psychology actually works in the brain. Instead, we should use something called the test for the controlled variable, and you can look for this in more detail after seeing this talk. But the test for the controlled variable is a way of applying a disturbance or measuring a disturbance and looking to see whether the individual keeps some perceived aspect of themselves or the world constant, despite the fact that the experimenter is trying to apply a disturbance to it. And when we understand what the controlled variables might be for a person or for an animal or for a system, we can build a blueprint, often a computational model of this process, and test that against the data. And that prototype testing arguably is a much more robust way of testing a theory than some of the other methods that we're familiar with. Okay, just one example of the evidence for perceptual control theory, but there's others that I review in the book chapter on this page. But a classic one that really, I think, helps grasp perceptual control theory is the baseball catching simulations. So Rick Markin and Schaffer and colleagues worked on a series of studies looking at object perception. And they discovered that in order to catch an object or to intercept an object, so you're, for example, a fielder in cricket or baseball, and you're having to get into the right position in order to catch the ball. In order to do that, it's not necessary to somehow understand the physics or to predict where the ball is going to land. All you need to do, if you look in the top right of this video, is to keep a constant velocity of that image on your retina, and to keep it centralized into the center of your retinal image. So what happens is you get some constancies, some invariants that happen perceptually for people, but they happen because they're adjusting their behavior dynamically to keep that state of affairs true. And if you think about it, if someone's throwing you a ball and you keep on trying to keep it in the center of your vision, you're going to end up in the right sort of lateral displacement from where that ball is going to land in order to catch it. But you don't need to be thinking carefully about where you put every step in order to do that. And so in this video, you see how the running rate in the bottom right of the video is different every time, because that is happening dynamically, that is emerging dynamically to allow that fielder to keep in the right place to catch the ball. And they verified this by literally attaching video cameras to fielders' shoulders whilst they're engaging in the catching process, and it shows that image on the camera has got similar properties to those of the simulated retina in these models. So I think this is a really good example of perceptual control in action. So I've given you a lot of quite concrete examples of everyday skills. What about in the difficulties in mental health problems, and coming back to those? If you were to take a survey of the literature, you would find that actually problems with control come up again and again across different presenting problems. Eating disorders, anxiety, the sense of lack of control within a trauma, and instances like panic attacks or the experience of psychosis are almost defined by loss of control or sometimes delusions of control. So therefore, a theory of control is very well placed to understand them. So the proposal, as you might expect from how I've explained the earlier parts of PCT, is that it's unresolved goal conflict that is the kind of pernicious, unseen cause of loss of control and distress. That to resolve that, people need to be able to apply this reorganization process to the source of that conflict, and they need to keep it there. And this is the focus actually of their conscious awareness, where that change and that reorganization is happening. And the idea therefore is that effective interventions, whatever they are the ones that help people to shift and sustain their conscious awareness to the source of these conflicting goals. And on this slide you'll see some references for this work. This brings us to the transdiagnostic approach, because if we now have a universal theory of well-being and distress, we can apply this across different presenting problems. And the transdiagnostic approach is a way to try and understand what's shared across different psychiatric disorders and on the spectrum with everyday functioning. So very recently we've put together the Transdiagnostic Mental Health Network. We have a Twitter site, and we'll soon have a website available where people can engage in the discussion around these processes. The evidence is actually pointing to the fact that all psychological processes that have been studied and known to be maintaining distress are transdiagnostic. They're found in multiple disorders. And we found that one factor comes out of analyses we've done where we've looked at the correlations between these different processes, whether they be thought suppression, worry, experiential avoidance, behavioural avoidance, etc., etc. And it's the PCT point of view. Obviously there's lots of theories that are transdiagnostic, but it's the PCT points of view that it's the capacity to shift awareness to the perceptions that are at the background, that are kind of fleeting, that are around whilst we're expressing and describing a problem, and sustaining our awareness on those, which allows this reorganization process, which then resolves the conflict over time. And that this process is what others might call, for example, psychological flexibility. Anyway, we have a network now where we can discuss this idea amongst others with people who also subscribe to a transdiagnostic approach. We've done research that looks at the role of control in mental health and mental health interventions. So, for example, we've done a task where people can control their distance from an image on the screen. So, for example, we have in this one some neutral images that the person's controlling on a corridor, but then they were given the option of controlling spider images. And half of the participants in the study could control the spider image. So here's an example. They could control exactly where it was in front of them on this corridor. Okay. Then there are another half of participants that were given the spider images at exactly the same distance, but they weren't in control of it. And what we found is that it was the participants who controlled that image, even though it was the same level of exposure, that got closer afterwards in a behavioural approach task and had less avoidance 2 weeks later. So it seemed to be important to be in control of exposure for those participants. There's also studies that Tim Carey and colleagues have carried out showing that if you give people control over their appointment scheduling, the timing of their appointments, the number of their appointments, then that actually reduces non-attendance rates and reduces waiting lists. And we've also tried to analyse what it is about a therapeutic relationship and understanding that in terms of control. We've found evidence in the literature that the factor is actually autonomy support, particularly in exposure, that underpins the effectiveness of the relationship. If you think about it, autonomy support is actually doing what you can do to help the client have as much control as they want to exert. We've also done studies showing that talking openly and freely is what the therapeutic relationship seems to provide, and potentially that it's there to help the person control their own awareness through being in a safe environment with the therapist. So arguably, it's control that is the active ingredient of effective therapies in terms of the relationship as well. And that comes into the kind of interventions that we have used that utilize PCT, which I've listed here on this slide. So method of levels is a one-to-one conversation where the client talks about a current problem. The therapist remains authentically curious throughout, asking about the problem, but also asking about disruptions. And disruptions are what the therapist perceives might be an indicator of a background fleeting perception or thought, an image, a thought, a feeling, an impulse. The idea is that all the therapist does is ask these questions to help the client explore their problem in more depth and detail, bringing things from the edge of their awareness to help explore it further, with the view that that will allow this most effective form of reorganization. There are many studies published on method of levels, but to be brief for now, it's been applied often in outpatients in GP practices across different presenting problems, but we've also applied it in high schools, in first episode psychosis, as a drop-in in inpatient psychiatric wards, and also through video conferencing. And so in my work at Curtin University, I want to apply method levels to other contexts, and one that we've applied for is to provide method levels to people with COPD who've got serious lung difficulties, for which the recommended intervention is known as pulmonary rehabilitation. Many people don't ever get through their rehabilitation program. It's quite arduous. It involves lots of techniques and activities and regular attendance. And so there's a big problem in real life about people actually engaging in this. And so our idea is to use method levels as part of what's called a discovery session to help people talk about their conflicting priorities and their conflicting goals, and to work through and find activities that help them maybe use their bodies more, engage in some cardiovascular exercise as a stepping stone to engaging in the program. So this is a grant proposal that we put through. We're also working in partnership with Act Belong Commit in Western Australia, because they have a vast array of different activities that people might be interested in as a stepping stone or as an alternative to the rehabilitation program. We've also developed Milo, or Manage Your Life Online. There's a video for this which I won't show now, but you can access through the text link. This is an artificial emulation of method of levels therapy. It's a text-to-text interface where the user can describe a problem in text, and the computer scans what they've said and comes up with a useful question drawn from method of levels. We're currently engaged in research on Milo, having established proof of concept in earlier research with university students, and we have a consumer panel of young people from Western Australia who are helping us to design the smartphone interface for Milo so that we can eventually evaluate it in a larger scale trial. We've also got a group of honours students at Curtin University improving the coding of method of levels therapy so that we can import that into Milo and improve its capacity. We also have the Take Control course, which is a fairly extensive course where originally adults with anxiety and depression, the whole spectrum of different problems under that label, come along weekly for 6 weeks and actually learn about these principles of control and conflict and the higher levels in very practical, very everyday exercises. And we have things like the upward arrow to help people ask those why questions and work out what kind of principles and values are in conflict when they're experiencing stress. An awareness exercise where they're working through those and trying to bring them to bear in an everyday problem. So we have a manual published for the Take Control course. We've done a non-inferiority study to show that it's non-inferior to low intensity one-to-one CBT, at least over the short term in adults. And now we have applied for a grant funding to adapt a Take Control course for adolescents online. We have an adolescent version that's been delivered in Manchester or around Manchester, which has been taken up very enthusiastically by schools. It has all kinds of films and music and arts and crafts into it. We want to further adapt this so that we can help adolescents in Western Australia who live in remote and rural areas to gain this way of conceptualizing their problems and approaching recovery. And then we have 4 Ds of dealing with distress. In some ways, it's a condensed version of the Take Control course. The reason we developed it was because during the COVID crisis, the enterprise who I work with, Beyond Psychology, who work largely with organisations working with children and their families, were approached to get support for their professionals and their practitioners who during COVID were going through inordinate amounts of increased stress. And yet they were so busy that they were telling Beyond Psychology they only had one 90-minute session to do their stress management training. Clearly that's a challenge, but we rose to that challenge to see what we could do in 90 minutes. So we developed an interactive online video conferencing involving a lot of use of conversation and the chat function where people generate ideas to get across some of these core principles. And the idea was to empower people to use what they knew already, like their everyday things they knew worked, like having a bath or going for a walk by the sea. But then seeing the place of those activities alongside, for example, other things they'd learned, like mindfulness or applied relaxation, and also seeing a place for that alongside really getting to the root of what the problem was, which we call the discovery aspect of 4Ds, which is a way of empowering non-mental health professionals to employ some of the principles of method of levels, to start to have that curious inquiry and active listening that helps the person you're listening to resolve a problem better, and to just gear them in that direction rather than the direction of just trying to solve it there and then, or some of the frustrations that they might go down if they're not in that discovery oriented frame of mind for the person with the problem. Now this 4Ds has had great feedback from the 1,000 or so people that have received it, and we accredit training now through Beyond Psychology. But in terms of actually controlled studies, controlled trials compared to another condition, we haven't engaged in that research yet. So that's a focus of a planned PhD at Curtin University to establish the research base for 4Ds. It's interesting because 4Ds actually brings in lots of evidence-based techniques into its training, but we've not tested that package as if you imagine it. The other thing to say is 4Ds is still underpinned by perceptual control theory because it's all about control. It's just getting across the idea that sometimes when we try and regain control in a short-term way, that can be helpful, but it also might have side effects that create conflicts. And that's why we need to be open-minded to try and look for long-term ways of trying to resolve a problem. Just as you might do as if it was a problem with your car or a medical problem. There are short-term ways to deal with it, like blowing up a tyre if there's a very small puncture, but there's also long-term ways of dealing with it, like getting a new tyre. Just as is, if you've got a rash of a medical problem, there's a short-term way of kind of ointment or a antihistamine, but maybe a long-term way of actually finding out what the source of the allergy is and kind of understanding that, how to manage that in your life. So anyway, that's the 4Ds. I'm also involved with empowered conversations. This was developed mainly by people at 6 Degrees Social Enterprise, also in Greater Manchester. And it's interesting, this is also led by perceptual control theory, but because it's not therapy, it's just about talking in everyday terms to a person who's living with dementia. It has a slightly different flavour to it. So the idea is that we can help train people who are carers of those living with dementia to talk to them in a way that gives both the carer and the person living with dementia a greater sense of satisfaction from that conversation and less stress and tension. And it's the way it's done is helping the carer to give the person with dementia more control over the conversation. And so rather than questioning, it's about an invitation to respond and an opportunity to respond. It's about how to help carers realise the complexity that's in our language and how to not have to rely on some of these things to do with memory and shared knowledge that can really undermine the control of someone who's experiencing dementia. We are currently engaging in a feasibility control trial of empowered conversations, and so we will find out soon if we can translate that to a full-scale trial. As you've seen with a lot of the work that I've been involved with, consciousness and conscious awareness is integral to these very practical implications. And I was becoming aware over the last few years of just how many theories of consciousness there are out there. Some are by psychologists, others are by physicists, mathematicians, for example, biologists. And I was very aware that Bill Powers had already written or produced a theory that had implications for consciousness back in 1960 in a very practical way that we've been using in these interventions for a number of years. And so I thought it was timely to write a paper that introduced Bill Powers' theory of consciousness alongside PCT, and also added some new aspects that helped maybe integrate what had gone before in terms of theories of consciousness and bring it to a new audience. And I put this theory together, sent it to Psychological Review because I thought you need to start at the top and work your way down. But the editors and reviewers there thought it was worthwhile, and it is now published with Psychological Review. So I'm really pleased with that. What does the theory say? It says a lot of what I've just been saying in this talk. It particularly talks about the role of fringe consciousness as a kind of a palette, if you like, for bringing new inputs into our focal awareness. So that kind of partnership between the figure and ground, if you like, where we make new meanings of our experience. It also talks about potentially a new intrinsic system in the brain. Now, Bill Powers talked about intrinsic systems that are there to develop our perceptual hierarchy. So when we experience what he called intrinsic error, which is error in our biological systems, such as those governing our body temperature and our blood glucose levels and our pain thresholds, for example, when those go out of kilter, they drive learning and they drive reorganization. And as we've seen, reorganization seems to be associated with awareness in PCT. But if reorganization and awareness only came into play when we had intrinsic error, then you might imagine that consciousness would be a very stop and starty kind of process. What would be driving reorganization when things are going fine? Okay, when it's in between some of these disruptions and issues that we have. And so I've put forward in this paper the idea that there's another intrinsic system that humans and certain other animals have that makes us curious and drives us to reduce error in our perception, even when our life isn't in danger or when our other biological systems are kept in quite good bounds. And so the idea is that we have a drive to continue to integrate new inputs and form new perceptual functions, some of which can be the ones that are at high levels and resolve conflict, maybe now or in the future. And that is something that we're doing all the time to buffer against stress and issues that might come in our lives. And that continuity that comes as in consciousness, that comes as a side effect of doing that, allows us then to be able to use what we call the propositional systems, these ways of symbolically encoding our experience, which then allows us to produce things like language and mathematics and autobiographical memory, for example, that give us this other way of conceiving of reality. And it's a symbolic coding that we can then share in books and instructions to other people. And also, because as humans we have this ability to draw recurrent connections within the hierarchy, we can do this within our own minds, not just through interacting with the environment in front of us. So that's in a nutshell what that paper provides, but I think if you read the paper you'll see that laid out more clearly. And this model is also one that I want to be testing. One way of testing it is to see whether this novel integration rate, as a novel information integration rate, as I've called it, the idea that we're collecting in new inputs all the time to form new perceptual functions, is this something that each of us is doing at a rate that's just right for us? Okay, and does it account for the fact that we might keep that rate going in various different ways depending on what we've learnt? Are we doing it by mind wandering, by planning, by looking around us, by going into new environments? In everyday life, that's what we're doing. If we can bring participants into a relatively homogeneous environment, like in one of these immersive reality facilities that we have at Curtin University, we can see whether we can measure that integration rate. And there's a game called Conway's Game of Life, which breaks down a visual display into known bits of information. So we're going to see whether people self-regulate that complexity of their stimulation by being in charge of this game of life. So that's our kind of quite blue sky plan for the hive environment. We're also putting forward a PhD proposal to explore much more about this background consciousness and how important it might be, by interviewing people and doing some live examinations of it in analogues of therapy. We're also going to use what we think might be a biomarker of this process, and that's pupil dilation, because there's been some recent reviews to show quite how accurate and accessible pupil dilation is as an indicator of taking in new inputs. So that's the plan for the PhD proposal. I also want to say a couple of words on interdisciplinary directions. A couple of years ago, I completed editing a handbook of perceptual control theory that brought together authors across the world who have used PCT in their own separate disciplines, including neuroscience, learning theory, ethology, robotics, linguistics, child development, sociology, and work psychology. In the last year or two, I've worked with Tom Schultz, Viv Huddy, and Eva de Hula to put together volume 2 of this handbook. And we've now got together the manuscripts for, again, a new, completely new selection of authors, again from around the world, from the disciplines that weren't represented by the first handbook: health psychology, mental health services, dementia, education, cultural anthropology, phenomenology, forum theatre, human-computer interaction, cancer care, human performance and leadership. And this book is now being put together with the publishers, and we hope to have that released early next year. So, in summary, according to perceptual control theory, life is control. We control our inputs, not our outputs. And if that's one message that you take from today, it's that. That therefore we need to balance, organise and resolve the conflicts between everything that we're trying to control in our life. And it is consciousness that achieves this. I've gone over with you the implications that this has for research methods, for interventions and much more. And I'd really like anyone watching or listening to this to keep in touch and to give their reflections and feedback. We have a number of sites on Twitter that relate to the topics that I've talked about today. And I've also put together a playlist of music that's relevant to today. I feel like sometimes it's music that actually gets through a message better than talking and slides. And so you're welcome to have a listen to the Spotify playlist as well. So thank you for listening, and do keep in touch if this is something that interests you. Thank you.